Good afternoon, everybody. Today's Battle Rhythm, Telehealth Resources, Connecting Veterans to Telehealth, will be hosted by Jeanette Gillis. Jeanette is the director of the network at America's Warrior Partnership. The network provides local veteran-serving organizations with a connection to national resources when a vet's request cannot be met locally. To find out more about the network, please visit americaswarriorpartnership.org/the network. That's it for me, Jeanette. The floor is yours.
Hello, everyone. Happy December. I know everyone's looking forward to the holidays, and it's a great time of year. So thank you for taking time out of your day to be here. I'd like to welcome any of the folks that are here from our branches, our 4-Star Alliance members, veteran serving organizations, and any guests that are joining us today. We're glad that you are here. We have an interesting presentation for you today. We're going to be joined by Anthony DeFelice. Anthony is a contract supporter for the Office of Connected Care at the VA. Kelsey Robertson is a communications associate, and she is also contract supporter for the Office of Connected Care. I'm going to go ahead and invite Chelsea to share her presentation, and we'll get started.
Perfect. Thank you so much. My name is Kelsey Robertson. I will be presenting today alongside with my colleague, Anthony DeFelice. Starting with a few reminders. Like they mentioned, we are keeping track of your questions through the chat, so please feel free to drop any questions you have for us through the chat. We have some colleagues monitoring the chat throughout the presentation, and we're happy to take questions at the end of the presentation as well. If you're experiencing any technical difficulties, like we are, feel free to let us know in the chat box, and we'll try to get those sorted as well. And wanted to just give you all a quick rundown of the Office of Connected Care and who we are. So one of the awesome parts of Anthony and my role at VA is to get out in the community and hear firsthand feedback from veterans, their family members and caregivers, and VA staff, and hear their opinions about connected care resources. And while doing so, it became apparent to us that while some people likely use a few virtual care resources, they really aren't aware of all of the different options available to them through VA Office of Connected Care. And so whether a veteran has newly enrolled in VA, has recently transitioned out of service, or has been a VA patient for many, many years, virtual technologies make it easier than ever to access VA care. Our hope today is that you all leave this presentation with a better understanding of all of the connected care tools and resources that are available to the veteran community. So throughout today's presentation, we'll talk about some of the virtual care options that make VA care more convenient and accessible, including My Healthy Vet, VA Telehealth Services, and VA Mobile. We'll also discuss some resources to help veterans gain access and start using virtual care. So Office of Connected Care is made up of 3 core pillars. So we'll start by discussing the first pillar, which is My Healthy Vet. So many of you are probably at least somewhat familiar with My Healthy Vet. It's definitely one of our more popular virtual care tools. But if you are unaware, My Healthy Vet is VA's online patient portal. You can really think of it as a one-stop shop for all things VA healthcare. It gives you access to information that you need to better understand and manage VA care. So for example, with a free My Healthy Vet account, veterans can refill their prescriptions, keep track of upcoming VA medical appointments, and also schedule those appointments, view their VA medical records, and also send secure messages back and forth with their healthcare team. So I mentioned a little earlier that part of Anthony and I's job with VA is to go out in the community and get feedback on VA virtual care tools. So we've had the chance to hear some powerful veteran testimonials firsthand and wanted to share 2 short testimonials with you all. So we'll play the attached video, and you'll hear from 2 veterans who we met at a VSO National Convention this past summer.
My name is Yannicka Rubian Moore Trent, and I am an Army veteran. I get my health care through the Durham VA Medical Center. My Healthy Vet has been a lifeline for me because I am housebound and supposedly bedbound. Most of the time I am. And I can do my prescriptions through there. I can secure message my doctors through there.
Sometimes we go to the VA, it can be very busy. And a lot of our disabled veterans find it hard when they have to leave the house and go to an appointment. So telehealth is very beneficial for those veterans who have a hard time leaving the house. But also at the end of the day, it's very convenient when you don't have to go to the hospital, but you can receive the same care.
As you heard in the first interview, My Healthy Vet is making it easier for veterans to access the care that they deserve and that they have been granted. So we wanted to share a few stats from fiscal 2024. And if you're unfamiliar, government fiscal 2024 was October 1st, 2023 through September 30th, 2024. So there were over 3.5 million users signed into My Healthy Vet. And those users sent over 40 million secure messages and requested 34 million prescription refills. So while we played 2 short testimonials today, there are millions of veterans across the nation who use My Healthy Vet on a routine basis. So with all of this talk about My Healthy Vet, we would be remiss not to mention some upcoming changes that will impact the user experience of My Healthy Vet. You all may have heard that My Healthy Vet is moving to a new home on va.gov. I want to stress that this does not mean that veterans will no longer have access to My Healthy Vet. We're simply just making some changes to the sign-in process to hopefully streamline access for veterans. So starting next year, veterans will have 2 primary web and mobile options for managing their health. One being My Healthy Vet on va.gov, and the second through an app called VA Health and Benefits, which we'll talk about in the later slides. So what is exactly changing with My Healthy Vet? By 2025, we're moving to 2 secure account options, login.gov and ID.me. So these accounts will streamline access while adhering to some increased federal security requirements. Wanted to note some key dates for you all. So after January 31st, which is quickly approaching, veterans will no longer have option to sign in to va.gov, VA mobile apps, or other VA online services with their My Healthy Vet user ID and password. So again, My Healthy Vet itself is not going away, but the ability to sign into VA services with a My Healthy Vet username will no longer be available starting in February of next year. And then later on in the year, after September 30th, 2025, veterans will no longer have the option to sign in with their DS logon username and password. So after these dates, veterans will have the 2 sign-in account options. And again, those are login.gov and ID.me. We're frequently asked about the rationale behind these changes and wanted to be as transparent as possible. These changes were in part due to a federal executive order to increase protection of veterans' identities and information, and hopefully prevent fraud. We are confident that data is secure in our current system, but we know that unfortunately, veteran information is highly sought after and cyber threats are constantly evolving. So we wanted to be as ahead of the curve as we could. We've also heard from veterans that they want an easier way to access their resources, primarily asking for the reduce in number of times they have to sign in to access a resource. So we've listened and we're making changes to hopefully help streamline the process. So the next pillar of connected care to discuss is VA telehealth services. VA is dedicated to providing veterans with the best health care. And VA telehealth services are key in supporting this mission, not just saying that because I support Office of Connected Care, but data shows that veterans turn to digital tools to access care more and more frequently. So what do VA telehealth services do? VA telehealth services are a modern way to deliver veteran and family-centered healthcare by connecting veterans with their care team, no matter where they are. So telehealth really bridges healthcare access and expertise across distances that otherwise separate some veterans, especially those living in rural areas, from the care that can best serve them. So through real-time video visits, in-home and mobile monitoring, and technologies that gather and store clinical information, VA telehealth services are bringing care closer to home for all veterans. In fact, any veteran who is eligible for VA healthcare is also eligible to connect with their care team through telehealth. So VA's Anywhere to Anywhere telehealth initiative removes legal, regulatory, and technical barriers that prevent veterans from receiving accessible, high-quality care from anywhere in the nation. This initiative allows veterans to access care from their preferred location, whether that be at home, in a clinic, in a hospital, really anywhere that they need care. They're able to access that care through a mobile device. So it ensures that veterans can receive the care they need, even if they aren't located near a VA medical center, or if the specialty care that they're seeking is delivered across the country. Telehealth can really be used to enhance all VA healthcare services. In fact, VA currently delivers care through telehealth in over 50 clinical specialties. These are things like primary care, mental health care, and even specialty care for stroke and cardiac issues. And across these specialties, VA uses synchronous telehealth. So these are things like the real-time video visits, asynchronous telehealth, and remote patient monitoring to complement and extend traditional in-person care. And then the third pillar of connected care that we wanted to highlight today is VA Mobile. So VA Mobile is home to over 100 apps, all completely free to download for veterans, their family members and caregivers, and VA staff. With over 100 apps, there is truly an app for everything. There are apps that help veterans manage their health and increase communication between them and their VA care team. So you can find a variety of apps that support your health needs, ranging from things like stopping tobacco use, improving your sleep, or managing your weight. There are also apps that can help you manage your mental health and improve your mental well-being. So with so many options, it can definitely feel a little overwhelming to know where to start. So we wanted to take a few minutes to talk about a few of the most commonly used apps. But I definitely recommend, if you have a free second, to take a moment and look through the VA App Store when you get a chance, because there really are a lot of great resources. So the first resource we wanted to highlight is VA Video Connect. VA Video Connect is VA's secure video conferencing app that allows veterans to meet face-to-face with the VA provider through their smartphone or computer or tablet, really anything with a camera and the ability to connect to internet. So this app is really convenient for those with health conditions that make it difficult to travel. So especially for veterans who live far away from a facility, or they just simply don't have the time to attend an in-person appointment, VA Video Connect is a great resource. VA Video Connect became increasingly popular during the COVID-19 pandemic, when many appointments were required to be conducted virtually. Since the COVID pandemic, VA has improved accessibility of VA Video Connect, and more recently, VA launched the Caregiver Connect scheduling option, which enables veterans to invite up to 5 guests to join their visit. So if a veteran is interested in joining a visit, or they want to get their caregivers added to their upcoming appointments, we recommend that they talk with their provider. So this app is a little bit newer. It actually just became available nationwide this year. But VA Health Chat enables veterans to quickly connect with VA staff members in real time from anywhere that they can use a mobile device or computer. And so with VA Health Chat, veterans can send secure messages to receive live medical advice for non-life-threatening health concerns. So of course, if you're experiencing a medical emergency, we recommend calling 911 and seeking immediate care. But for minor health concerns like minor illness or injury, VA Health Chat is a great option. You can also use VA Health Chat to schedule appointments and refill prescriptions. And the great thing about VA Health Chat is that responses are typically under 1 minute. So if you're looking for a reliable, quick answer to a non-life-threatening question, VA Health Chat is a great go-to and an alternative to turning to Google and falling down that rabbit hole that I'm sure we've all been in before. This is actually one of my personal favorite apps. So I'm sure if you all are anything like me, you've probably gone to an appointment before, and then as soon as you got home, you struggle to remember what exactly you were told at that appointment. Unfortunately, this is an all too common issue that I know I definitely struggle with, as well as many others. So luckily, VA has developed a resource to help keep veterans on track and be an active participant in their healthcare. So Annie for Veterans is an automated messaging app that uses instructions from VA providers to help veterans stick to their personal care plan between appointments. So let's say your doctor wants you to monitor your blood pressure every 3 days. The Annie app can send you a reminder every third day to check and report your blood pressure. Veterans can then respond to Annie through text or the Annie app, and then VA care teams can automatically review their responses. In addition to reminders, Annie can also send other helpful messages like motivational messages and wellness tips directly to your phone. But it is important to remember that Annie helps you record your health data, but it is not a way to message your doctor. So while you can send your responses to your care team through Annie and they're able to view those, they cannot respond to you through the app. If you need to send a secure message to your care team, we recommend continuing to use My Healthy Vet or VA Health Chat. So I mentioned earlier that VA Mobile has apps for mental health. The Mindfulness Coach app is a great example of mental health resources available through the VA App Store. The app was developed to help veterans and service members learn how to practice mindfulness, which has been shown to be effective for reducing stress, improving emotional balance, increasing self-awareness, and helping with anxiety and depression. The app provides self-guided training programs designed to help users understand and adopt a mindfulness practice. Mindfulness Coach also offers a library of information about mindfulness, 12 audio guided exercises, and goal setting and tracking. I mentioned before there are a ton of apps available on the App Store. This is just one example of a mental health app that is offered through the App Store. So if you think something like this or a similar app may be helpful, I definitely recommend that you take a look at the App Store. Last, but certainly not least, is the new VA Health and Benefits app. Like the name implies, with the VA Health and Benefits app, veterans can manage their VA healthcare benefits and payments directly from their phone or laptop. VA Health and Benefits can be used to manage existing VA claims, download common VA benefits letters, schedule healthcare appointments, and even show proof of veteran status. I mentioned before that My Healthy Vet is your one-stop shop for your VA healthcare needs. Think of VA Health and Benefits as the one-stop shop for all things VA. This is a new app, so we are still working out some of the kinks, but this is a really great resource to access all information about VA from one spot. And with that, I will hand it over to my colleague, Anthony, to discuss a few more connected care resources.
Awesome. Thank you so much, Kelsey. So we learned a lot about the different technology that the Office of Connected Care offers through apps, the telehealth program, and the online patient portal. But in addition to that, we do a lot of work in connecting veterans with the actual and physical technology so that they are able to access those apps, the online patient portal, and conduct those personal appointments with their providers. We call it the Bridging the Digital Divide program. And so the Digital Divide Consult program ensures that no veteran is left behind due to a lack of technology or internet access. On the screen, you see kind of a standard process of how a veteran can request access to VA devices or get support with internet connectivity. So the process usually begins with the veteran speaking with the provider in their interest in telehealth or doing online appointments, and then the provider from there identifies whether they would benefit from those digital options or what would work best with their capabilities. And then from that point, they're connected with a social worker who continues the digital divide assessment, looking at different factors, and then from there, the actual eligibility and qualifications on what technology and kind of benefits are given to the veteran at that time. So since 2020, we've had over 178,000 consults that have connected veterans with resources. Those are things like iPads, tablets, internet subsidies, etc. We have an existing partnership with the FCC's Lifeline program, which offers kind of additional discounts and enables veterans to bridge the connectivity gaps. Right, looks like we're back on slide 19. There you go. There we are. So VA internet connected devices. Devices like internet connected tablets are loaned to veterans, preloaded with the apps to support the virtual visits. So essentially, if a veteran becomes available or qualified for a tablet, we send them a tablet that has the capability to connect to the internet and a whole gamut of apps that are personalized to their healthcare treatment plan. We are also able to provide veterans at the request of their VA providers peripheral devices, including a pulse oximeter, a blood pressure cuff, and thermometer that takes real-time readings and that send them directly to their providers via Bluetooth. So the equipment is Bluetooth enabled, and it allows the provider to have real-time access to those vital signs. And then we have a short kind of video here. See if this goes ahead and play.
Partnered with T-Mobile for Business. With VA Video Connect, powered by T-Mobile, vets can speak to their doctors from virtually anywhere and get the care they deserve without it counting against their data. So they can return to their most important posts: soulmate, best friend, or just dad. The VA provides the care. T-Mobile provides the coverage.
I know that was a little choppy, but the presentation will be provided afterwards, but that just goes in an overview of our existing partnership with T-Mobile. So again, the presentation will be given to you at the end, so you can watch all the videos that we've come to show throughout this presentation. Connected device IT support. So in addition to providing the technology, making sure that we give the veteran a full experience, we don't just stop at the delivery. We really try to provide a hands-on IT support for setup, giving them a really hands-on experience on how to use the device, how to access the different apps, and how to set up the call with their providers through VVC or the Video Connect. So our assistance, which is on the screen here, is everything from the setup, the test call through VA Video Connect, the setup of peripheral devices, the ones I mentioned a little bit earlier. And then if there are any additional apps that the veteran might need in their healthcare journey, we also show them how to install those apps and how to utilize them, because there's as Kelsey mentioned earlier, quite a few of them. And then, so in addition, to sending technology, we also have a few remote sites that veterans can go to kind of access the technology, especially in rural areas. So Atlas, or Accessing Telehealth Through Local Area Stations, is a program addressing connectivity challenges for veterans in remote areas. By partnering with private and public organizations, we've created community telehealth access points that are kind of comfortable and private, and these locations mimic a living room setting. It's a way for the veteran to have their appointments in a distraction-free environment for video consults. Our future goal with Atlas is to expand the program through grants and move more organizations to help establish telehealth hubs in partnerships with VA facilities. With Atlas, we're redefining access to care and ensuring veterans stay connected no matter where they live. Virtual Health Resource Centers is another program that our office oversees. They provide direct support for veterans, families, and care teams interested in using virtual care tools effectively. So with 56 sites live and more in development, VHRCs are part of a growing national network aimed at simplifying virtual care options. These centers offer hands-on assistance and education, ensuring veterans can navigate tools like VVC or VA Video Connect, and the other mobile apps with confidence. Our implementation consult service actively works to establish VHRCs, further expanding access and bridging the digital divide. So kind of think of VHRCs as a hub for veterans to empower them, making with the technology, the apps, and bridging the gaps, any gaps there might be between them. We're really trying to break down the barriers and meet the veterans wherever they might be. So we've talked a lot about the different programs, the technology, getting access to that technology. So in this presentation, obviously we might have some questions, but we wanted to provide some contact information on the different pillars that we talked about at the start. So we have the Office of Connected Care, the My Healthy Vet, which is, again, the online patient portal, and the VA mobile, different help desk solutions that the veterans can either call into. And then on another side, we actually have the emails in which they can also submit requests and all of that good stuff. But again, meeting the veteran in case they do need real-time assistance with the technology and or the apps. And so this takes us to, we wanted to leave a significant amount of time for questions, but this takes us to the end of our presentation. So with that, we'll start grabbing some questions. I'll go back. Elisa or anyone want to start reading some that might be in the chat?
Sure. So Allison had asked what the difference between logging in with login.gov or ID.me is, and if there's a preference to recommending to veterans. Just to answer that first part of the question, either one works. Out of the 4 sign-in options available that are currently available, we do recommend sticking with either login.gov or ID.me, just because those sign-in options are not going away next year. So once you create those logins, you're all good to go. You won't have to create new logins. And to answer the question, will veterans need to create a new account? If you already have those login accounts, you won't have to create new ones. But if you haven't already, then you would have to create those accounts. And there's some information on how to create either one of those accounts in the link that I had just sent. I'll send it again here in the chat. And Allison, I do see another question from the registration. What options are available for veterans who receive care at the VA versus what's available for veterans without access to VA? So for veterans who are able to receive care at the VA, all of this that we had mentioned is available to them. If they don't have, whoever asked the question, if you want to elaborate, is it access to VA healthcare, like the insurance VA benefits, or is it without access to VA? There's nothing, VA medical centers around you.
I believe when the registration came in, what they were referring to is just veterans who are not registered with VA or not with the VA. Can they access some of the, I think I know that they can access some of the mobile apps. Is that correct?
Mhm. Yeah, that's correct. So some of the mobile apps available, they do require the secure sign-in login, but some of them, they don't require it. I know just off the top of my head, the Move app, it doesn't require any secure sign-in or VA login, so you can use that. Any of the VA apps that have a lock on them, those will require the VA credentials, but any of the apps that don't have locks on them, they're all good and available to anyone, that even if you don't have VA.
So I have the mindfulness app on my phone, and I still have it. But I saw on your PowerPoint that had a lock on it. Is there 2 different ones for maybe non-veterans or people who are not being served by the VA and other folks?
There should be, let me look. It shouldn't have a lock on it. They might have updated the app
Oh, I see. It doesn't on my phone. I still have access to it, which I really like. So I'm hoping it's not going away for me. So
No, that's perfect. I just looked at it on the App Store and it looks like it doesn't have a lock on it. So you should still be able to access it and everything.
And I did just want to chime in here, going off of what Elisa said about the lock icons. That is a great way if you're just quickly looking through the App Store to tell what apps you're able to share information with your care team. So if there is the lock icon, that means that you have access to either grant or deny. Sounds like a harsh word, but you can choose which data you would like to share with your care team. I know that is something, especially with the mental health apps, sometimes you might not want your care team to be able to look at everything that you're logging. So those apps do give you the option of what data you would like to share. So just wanted to put that out there that while, yes, some apps require that you get care through the VA, you still get to choose what exactly you would like shared with your team.
Thanks, Kelsey. And moving into the other questions, Megan had asked for clarification that Office of Connected Care is different from Office of Community Care, and that's correct. It is. They are separate offices. We do get that a lot. They're very similar in name and the acronym, so very understandable, but they are completely different offices. And Danielle had asked, are all veterans eligible for BP monitors? So for the digital divide consult in particular, there are a few different programs. For the digital divide consult, your physician will connect you with a social worker just to make sure that you're eligible. And then with that, you can get access to blood pressure monitors or any of those other peripheral devices that we had mentioned. And what is the percentage of telehealth by demographic? I don't have that off the top of my head, but we can definitely get out that information to you. Allison, if you could just share who sent that question, we can definitely get that information to them. And then where are the VHRCs located? Let's see. So we do have I do have a link where you can check out all the VHRC locations. So let me find that and I can drop it into the chat.
Elisa, I actually just dropped it into the chat. But like Elisa mentioned, there is a section at the top of that webpage where you can enter a zip code and it will tell you if there is a VHRC located near you. I will just say we're still expanding VHRCs. So if you don't see a location near you, that doesn't mean that there will never be a location. It could just mean they're still in the process of opening, or they're still early on in the implementation process, but definitely recommend checking out the locator to find a VHRC near you.
Thank you everyone for your questions. These are great. Cassandra, I do see your comment. Anthony, do you have any information on how organizations can partner with Atlas?
Yeah, so we're always looking for organizations to partner with Atlas. So I believe in this presentation, I would actually be the person that you email to. We are working on building that list. I think we formerly had a partnership with some select Walmart locations that we had the Atlas kind of lounge living rooms built into it. Right now we have, I believe, like 10-ish locations, 2 in Texas, 1 on the West Coast in California, and a few like in the Midwest area. So I would actually be the person to contact, and then I could kind of direct you to the VA, the lead on the Atlas lead, because we're definitely looking to build upon that. What other resources are available in terms of access to technology? What kind of resources are we specifically maybe looking for? I think definitely in the West Coast, we're looking to definitely build more Atlas locations. I think there's really just that one in California on the West Coast, but I don't think there are particular, like, we're really looking to focus on one specific area. I think we're looking at kind of an expansion in general for Atlas, especially in this new year. They're really looking at locations and seeing how we can potentially partner. I know we have one in Montana, and we partner with the University of Montana and Montana State University to have physical locations within the campus. And they do some select teleservices, a part of the Atlas program.
Just dropping a link. You can see all the Atlas and VHRC locations there. In that link, you'll just need to do the same thing with putting in your zip code. Sandra, that's a really good point. I know, like Anthony had said, they are trying to build out more Atlas locations. So if you want to get into contact with Anthony, we can definitely see what other options are out there or how we can.
Yeah, and then and in the meantime, maybe it is looking through at the digital divide consult to see if there is a way we can send technology or the tablets or any of those physical resources to veterans that might need it within that specific area. I think that's probably a great case scenario in which we would actually send maybe the tablet and any other supporting technology that the veteran might need in their healthcare journey to go along with that. So that is also a viable option based on just the proximity to a nearby VA facility. So we can send that along too. That is a great question that I'm not sure of. I'll write that down to see if that is a great question. I know that we've had existing conversations with some of the VA folks that oversee some of the tribal stuff, but that's a great question.
All right. Do we have any other questions for our presenters?
I don't have a question. I just wanted to thank our presenters for being here today and giving us a lot of information. And Anthony, you will probably expect to hear from Cassandra. So
I love it. I can't wait. Thank you so much. We really appreciate everyone's time and being engaging with the presentation. We appreciate and value all questions. So I can't wait to hear more.
All right. Well, I think that's our cue to wrap it up. I'd like to thank Anthony and Kelsey for a wonderful presentation and giving us all this information that it looks like some of us were not even aware of. And we appreciate you addressing Cassandra's questions and hopefully maybe opening this up to the Navajo Nation there, make it easier for them to get the information that they need. Thank you all for being here today. At America's Warrior Partnership, we partner with communities to improve veterans' quality of life and thereby reduce veterans' death by suicide or self-harm. We believe that communities are best equipped to improve the quality of life for all veterans, and our goal here, as is our goal today, is to provide community partners like yourselves with support, information, and best practices to help you deliver quality services to veterans in your community. Our next Battle Rhythm will be on January 6th, and our focus will be on veteran suicide prevention through effective evaluation practice. We hope all of you can attend. Wish you a happy holidays, and thank you for being here. Have a great rest of your day.
thank you, everybody.
Thank you, everyone.